From the outset, can I just say it remains the position of the Albanese government that given the enormous dislocation, stress, death and expenditure involved in the COVID-19 pandemic, it would be extraordinary not to have an inquiry into it. No one is walking away from that position that there is a need for an inquiry. We said that before the election. We have said it since, and that remains our position. Indeed, it was some 3 months ago that I stood here in a debate similar to this, raised by Senator Roberts in that instance, as opposed to Senator Babbitt, and confirmed that position. But to be clear, we are not yet through the COVID pandemic. It continues. Cases, hospitalisations and deaths related to COVID-19 continue. Maybe at a lower rate, but the pandemic is continuing. And for now, the government is rightly focused on monitoring and responding to cases and ensuring our systems are prepared to respond to future waves. Because we all saw what happened when these waves came throughout the pandemic and we weren't ready. We saw what happened in early education when educators were sent back into the classroom, into the playroom, without PPE, without any of the protection they needed to keep themselves safe, working with our youngest Australians, little Australians who weren't able to socially distance, who weren't even able to blow their own noses. Our childcare workers went back into that environment unprotected and unprepared and unheard when they raised those alarms. We saw what happened in aged care. When nurses and carers were exposed to the virus, we saw what happened when it ran rampant through these homes. We saw what happened when the government wasn't prepared with adequate PPE to protect residents and protect workers. And we saw what happened when the government delayed the vaccine rollout. I saw what happened. Friends of mine, doctors and nurses, were going into hospitals every day, coming back and telling me they felt like they were going to fight battle on the front line of a war, coming back to their homes and their children, terrified of what they might bring back, but absolutely determined to help and serve their community. Sometimes it's hard to believe that these are things which happened in our lifetime, let alone a few years ago, let alone being part of a pandemic in which we are still living in. And in all these systems, but especially aged care, we saw what happened when systems failed. We saw what happened when the government took their eye off the ball in terms of preparedness. We saw what happened when our essential workers weren't listened to in this environment, and we saw the impact on these facilities, in aged care, in early childhood, in our hospitals and in our skills. And at the risk of opening up a wild can of worms in this chamber during this debate, vaccination remains the single most important step each of us can take to minimise the risk of severe disease and death associated with COVID-19 infection. So, of course, vaccinations, that remains a focus too. Acting Deputy President, the pandemic was a once-in-a-century event from which governments globally must learn a significant amount about how to handle and prepare for such a catastrophic event in the future. That will include the Australian government, as it includes state and territory governments, most of whom are already undertaking their own inquiries into their responses to the pandemic. And these inquiries will provide important information to the Australian government and other levels of government and other actors in such a pandemic onto how to respond, on how to be prepared and what needs to change. So a review is wholly appropriate. It would be extraordinary not to have one. But the timing of this matters too. That timing must be well considered, noting Australia is still experiencing COVID-19. This is not over, and there is heightened risk during the winter months. When you're in the middle of risk, when you're in the middle of managing situations and systems. Acting Deputy President, I want to just take the last 40 seconds I have in this debate to thank and recognise all of those who did fight on the front line of this pandemic, all of those who I am sure are looking forward to review an opportunity to take part in that. Ordinary Australians who went above and beyond every day to protect their fellow Australians. Our nurses, our doctors, our aged care workers and others in the care economy who provided vital care to Australians in the most trying of circumstances. None of us will forget the faces of exhausted nurses and other healthcare workers during this time, but also those who kept the economy moving,